Did you know that 70% of US adults have experienced a traumatic event in their lives? That's over 223 million people. That's quite a lot. Hi, my name is Teresa, and I am a licensed clinical social worker by practice and the owner and founder of Esmeralda Wellness Haven. Today, I'd like to talk about trauma-informed care and how it could benefit you. So what is trauma-informed care? Trauma-informed care is a framework which understands that people's traumatic experiences can shape their relationships, their boundaries, their interactions, and their behaviors throughout their lives. Trauma-informed care is about creating a safe space where people are able to talk about the hard things and experience a sense of empathy, a sense of understanding, and a sense of belonging. Trauma-informed care should also cultivate a safe space where individuals are able to feel empowered and in charge of their autonomy, of their lives, and of their healing journey. When incorporating trauma-informed care in my practice, the most important thing to me is not just being there for the individual and having them tell me about the experiences that they're having, but it's also to help them feel a sense of empowerment, a sense of safety, and most importantly, a place where they're not going to feel judged and they're able to digest a lot of the experiences that they're having. As a clinician, I understand the importance of trauma-informed care and how it's not just about having individuals display symptoms and analyzing those symptoms and processing how things affect their life, but it's really about getting into the root causes and understanding that traumatic experiences are dictating and narrating some of these somatic symptoms that people are experiencing in their lives every day. In turn, when an individual's safety is not honored in trauma-informed care, this can exacerbate ongoing symptoms of feeling unsafe and on feeling re-traumatized. And if the individual is not able to be guided back into a sense of safety and belonging and stillness in their body, it can often produce ongoing distress and ongoing symptoms that could cause, again, further re-traumatization and the individual's inability to cope with the symptoms that are present. With all the research, we now know that trauma often shows up in physical symptoms, so physiological symptoms to individuals. These things can include increased blood pressure issues, diabetes, hormonal changes, emotional distress, inability to withhold immunity and certain conditions. So we do know, based on our research, that trauma is at the forefront of some of these conditions. So when these things are not assessed and are not talked about within a medical setting, sometimes it can also continue to produce more issues because in turn, we are treating symptoms and not the root causes. So why is it important to integrate trauma-informed care in a way that is going to honor and respect the individual's choice, the individual's autonomy, and the individual's safety? Well, it is important because, again, it is the forefront of a lot of the things that we're seeing with individuals that are coming. So remember that big number, that 70% of US adults are or have experienced traumatic experiences in their life, which is over 223 million people. These numbers could not be ignored. These numbers are valid. And these numbers can often change, and sometimes they're not changing for the less or for the better. Sometimes they are often increasing as we continue as a society to continue experiencing ongoing traumatic events that are generational and that also affect different subgroups. At Esmeralda Wellness Haven, trauma-informed care is at the forefront of my practice. I believe in the importance of incorporating trauma-informed care, trauma-informed language, and most importantly, I believe in the importance of empowering my individuals to have a voice, to feel seen, and to be able to embark on the healing journey that is going to feel long-lasting and that is going to be more beneficial and best beneficial to them, to their loved ones, and to anyone that they'd like to bring into their lives. My job is never going to be to provide advice or to tell my individuals how they should live their lives and what they should do, because my job is always going to be to encourage and to help them feel supported and to help individuals feel empowered every step of the way throughout their therapeutic interventions and environments. And most importantly, I'm always going to encourage my individuals to heal, harmonize, and flourish together.